I'm Dr. Janine Baer, and I'm here with your ANJC Health Tip. I'm here speaking with Dr. Thomas Bayne, who is an expert in digestive health and chronic illness. Dr. Bayne, what can you tell us and tell patients about what some of the most important things that they can do in their diet to help with chronic illness and chronic pain?
So if I could only say one thing,
yes,
I would have to say cut out sugar.
Cut out sugar, yeah.
That's the biggest thing. You know, when you look at just how sugar drives inflammation,
sure,
you know, so everybody has inflammation, but when you add sugar to it, it increases that exponentially. Yeah. And so, and then you can go to the full end of the spectrum and show that cancer cells actually feast off sugar and they expand and grow in the presence of sugar. So it's the easiest general one rule I can say to my patients is, you know, cut the sugar out, and then you know you're reducing the amount of inflammation in their body.
And you can see a result right away from that.
Right away.
Yeah.
Right away.
What advice do you give to patients? You know, and even folks like myself, who sometimes we find that we really crave sugar and we don't want to eat sugar, we don't want to have it in our diet, we know we're not supposed to do it. Right. We're kind of learning about why, research is telling us about why. What advice do you give to kind of curb that? How do we avoid that?
It's funny because a lot of the research is really starting to show that it's not really you that wants the sugar, it's the microbes in your microbiome that want the sugar.
Fascinating.
Yeah, and so if you can recondition your microbiome and get it to be in a healthier state, then the cravings for the sugar go away. You know, it's when that microbiome is unhealthy and inflamed and it's seeking a quick fix. It's seeking a sugar fix. And so that's candida, that's yeast overgrowth, that's not what's supposed to be happening in that area. So for me, when patients say that they're having a difficult time with that, that's a clear opportunity for me to have a conversation about their digestive health. And you don't necessarily have to have gas or bloating or some type of symptom for it to be a problem. Normally there's a sequence of questions that we ask, and we can figure out what exactly is wrong with their digestive tract and why that imbalance has created this bacteria that's craving sugar. But for the most part, in the beginning, it's just kind of just stop. Let's see how you do. If we need to give you some support for your microbiome to stop the cravings, then we have tools that we can do that with.
That's great. What are some dietary supports that maybe, if we're taking sugar out, right? We're kind of helping that microbiome become more healthy.
Yes.
What can we eat that will help support that healthy microbiome that we're trying to achieve?
It seems like a high fiber diet is good, but those fibers really should be coming more from vegetables than grains. And so when we're looking at a great diet, a nice anti-inflammatory diet, we're probably looking at with men 70% vegetables, 30% protein. And with women, we're probably looking at 75, maybe 80% plant protein, or I mean, sorry, plant vegetables with 25% protein. And so that is a key dietary shift for your microbiome. All those fibers coming in become food for your beneficial bacteria, and so they can increase their growth. It helps them proliferate
and get stronger.
Push out some of the bad guys. Yeah,
that's wonderful. Those are two wonderful tips that we can use right away. Thank you so much, Dr.
Thank you for having me.